we are looking at the in situ ductal and the lobular carcinoma of the breast. So in situ is also known as a ductal is dcis and lobular carcinoma lcis. So before we start, the questions are: comment on the mammographic signs comparing both, as well as comment on the bilaterality. So in this video we'll find these answers and learn in detail about this topic. So to start with, firstly we will be comparing lcis first and then the dcis respectively. So lcis along with the dcis respectively. So to start with, first we have the age. So what is this age? The age is 44 to 47. This is the lcis. Then dcis is nothing but about 54 to 58. So you can say the dcis is of a higher age compared to the lcis. Next, what about the incidence? The incidence is about 5%, 2 to 5%, and dcis is about 5 to 10%. Then what about the clinical signs in case of the lcis? The clinical signs is that it's mostly incidental finding. It is a incidental finding. Whereas what about the dcis? dcis is usually asymptomatic. It is asymptomatic, but the mass, pain and nipple discharge may be seen. So there can be a mass, there can be a pain, as well as there can be presence of the nipple discharge, which can be seen. Then when we look at the mammographic signs, MS, mammographic signs, so in terms of the lcis, it is none. There is no lcis, there is no the mammographic signs here. And when we look at the same thing in dcis, there is a microcalcification which are seen. Microcalcification are seen. So now to just recap, we saw the lcis and we're comparing it in the dcis. So under the age, it is from 44 to 47 age. Here it is from 54 to 58 age group. Then looking at the incidence, it is from 2 to 5%, whereas in dcis it is from 5 to 10%. So it's about 5 to 10%. Then when we look at the clinical features, the clinical features is nothing but there is a incidental. It is an incidental finding, whereas if you see the dcis, the clinical features, it remains asymptomatic. It is asymptomatic, as well as there can be presence of the mass, there can be presence of the pain, as well as there can be presence of the nipple discharge. Then when we look at the MS is nothing but the mammographic signs. So in the lcis, there is none. There is no mammographic signs, whereas in case of dcis, there is presence of the microcalcification. Next, moving on, the next heading we are going to see is in case of the premenopausal. In the premenopausal, so in premenopausal it is about 2/3, whereas in case of the dcis, the premenopausal is about 1/3. Next, in case of the incidence of synchronous invasive carcinoma. Incidence of synchronous invasive carcinoma. So here it is about 5%. Here it is about 5%. And in case of dcis, it is about 2 to 46%. Then when we look at the multicentricity, so in the multicentricity, so the multicentricity, it is about 60 to 90%, and in dcis it is about 40 to 80%. Now just to recap, we saw the premenopausal. So in lcis it is about 2/3, whereas in case of dcis, the premenopausal is 1/3. Then what about the incidence in case of synchronous invasive carcinoma? So here in lcis it is about 5%, whereas in case of the dcis it is say 2 to 46%. Next, when you look at the multicentricity, it is a 60 to 90% in case of the lcis. In case of dcis, it is about 40 to 80%. Then we move on to the bilaterality. So in case of the bilaterality, so in this case, in case of the lcis, it is about 50 to 70%. It is about 50 to 70%. In case of dcis, it is about 10 to 20%. Then when we look at the axillary metastasis, it is roughly about 1%. In dcis, it is about same thing, it is about 1 to 2%. Then when we look at the subsequent carcinomas, this is interesting. So in case of the subsequent carcinoma, so what is the finding? So in terms of incidence, if you see, it is about 25 to 35%, and here it is 25 to 70%. Then when you look at the laterality, it is bilateral here, and here it is ipsilateral. So then when we look at the interval to diagnosis, it is about 15 to 20 years here, and here it is about 5 to 10 years. Then if you look at the histological type, it is ductal. It is ductal here, as well as in case of dcis also it is ductal. Now let's just recap what we did here. So we are comparing the lcis as well as the dcis. So lcis, the bilaterality, it is about 50 to 70%. In case of dcis, it is about 10 to 20%. In axillary metastasis, it is about 1%, and in dcis, it is roughly around 1 to 2%. Then when we look at the subsequent carcinomas, under the heading of incidence, there is about 25 to 35%, whereas in dcis, it is a significant increase, that's 25 to, it can go up to 70%. Then what about the laterality? Laterality, it is bilateral in case of the lcis. This is very important. It is bilateral. In case of the lcis, is bilateral. In case of ipsilateral, it is ipsilateral in case of the dcis. Then when we look at the diagnosing, interval to diagnose is about 15 to 20 years in case of the lcis, and in case of dcis, it is about 5 to 10 years. Then when we look at the histological types, it is a ductal in case of lcis, and similarly it is ductal in case of the dcis. Now we'll be looking at the question we asked. So the question we asked was, comment on the mammographic signs. So comment on the mammographic signs. So under the mammographic signs, what we need to know is in case of the lcis. So in terms of the lcis, the mammographic signs is none. Then when we look at the dcis, it includes microcalcification. Then we look at the other one, that is, we said the mammographic signs. After this, we also have the incidence, that is a bilaterality. We asked about the bilaterality. So under the bilaterality, it includes the lcis is about, the lcis, it is nothing but the Insitu ductal, and so here the lcis, there is about 50 to 70%. Whereas in case of the dcis, in dcis, it is about the 10 to 20%. So there's a significant decrease in case of the bilaterality. So just to recap what we did here, so we asked the question about comment on the mammographic. So it includes the lcis as well as the dcis. In lcis, it is none, whereas in case of dcis, there is a minimocalcification, there's a microcalcification. And looking at the bilaterality, so in bilaterality, the lcis is about 50 to 70%, whereas in case of dcis, it is about 10 to 20%. So this was about comparing the dcis and the lcis. To learn and grow daily, please do subscribe.